Hi, everyone. Welcome to our fifth lecture on Hippocratic epidemiology and medical practice. Before I get into that, though, today, I'm going to start with just a little bit of background on an epidemic that struck Athens in the ancient world. So this is what you read about in Thucydides for this week. And just to give you a little bit of the historical context, from 431 until 404 BCE, Athens and all of its allies in the Greek world was at war with its main Greek rival, Sparta, and all of its allies. Now, in 430, Sparta's army invaded the land around Athens, burned all of the land, and that forced the rural residents to retreat inside the city. The epidemic struck, the plague of Athens, that is, while the city was overcrowded. So here is a zoom in on Athens. So this is what we might call, think of as sort of like downtown Athens. And Athens had built protective walls all around the city that connected them to the port nearby where they could get to their ships to get, food and supplies in and out. And these walls, the defensive walls, were impenetrable to the Spartan army. So what happened was most people, most Athenians that is, didn't live in the downtown Athens. They lived in the countryside around it. So when the Spartan army invaded, all of these people had to crowd inside the safety of the city walls. And so what you have is this very, very dense overpopulation and overcrowding of the city. And that obviously sets up especially bad circumstances for a plague or epidemic to strike, which is precisely what happened. Some of the symptoms of this particular plague are described by Thucydides. It involved things like high fever, bloody throats and violent cough, violent vomiting and diarrhea, blisters and sores, and unquenchable thirst. We don't know exactly how devastating it was, but our best estimates suggest that it may have killed as many as 100,000 people in Athens, which would have represented about a third of the city's population. So a really, really staggering proportion of people were lost to this particular plague. Historically speaking, we don't know exactly what the plague was, what this disease was that's being described. There has been some speculation by doctors and scientists in modern times. Here are some of the things that have been suggested. A lot of scientists or doctors just think that this may sort of be a disease that was lost to history, though it might not be any of these. But these are some of the things that have been sort of thrown out there. Now, I want to zoom in a little bit on just some of the details that we get from Thucydides' account. One of the things that makes Thucydides interesting is that, by contrast to the Hippocratics, who are presenting this very kind of technical medical perspective on, the nature of health and disease, Thucydides is really describing. So he himself is not a doctor, and he's really just describing how ordinary Athenians behaved in response to this epidemic outbreak. So what we're getting is some insight into how everyday people thought about disease and health and the nature of this epidemic, as opposed to a distinctively medical perspective. So what are some of the things we can learn from Thucydides? Well, one thing that he tells us is that the physicians, the doctors themselves, were not helpful. So the doctors at the time were unsure what was going on. They were trying to help, but ultimately failing. So we know doctors were very involved when this disease broke out. They were trying to come up with remedies, trying to figure it out, but they were failing to figure out what was going on and be able to help. Another thing that's interesting is that we learn from Thucydides that the Athenians recognized that exposure to the sick increased the risk of infection. So we know this from a couple passages. So for example, they noted that the physicians themselves who were trying to help had the highest mortality rates of anyone because they were the ones most exposed to the disease. So this is really interesting. The ancient Greeks didn't have our notion of how diseases spread. They didn't understand microorganisms. and bacteria and viruses and that sort of thing. But they nonetheless recognized that diseases tended to be transmitted more when people were in proximity to those who were suffering from it. So that's interesting. We see a similar thing in this other passage here. So one person would get infected as a result of caring for another. And one of the sort of tragic and heartbreaking aspects of all of this, as Thucydides reports, is that people were afraid to even help loved ones who were sick because they recognized that getting near an infected person would raise their chances of infection themselves. So many people died alone simply because there was no one to take care of them. They were afraid. We know that the disease was typically fatal. So this is the same passage. Thucydides reports that one of the most horrifying things about it was that as soon as somebody became symptomatic, they essentially treated that as a death sentence because the chances of mortality were so high once somebody had the disease. However, he also gives us some important details that tell us that it wasn't universally fatal. So it was typically fatal, but not always. And we know this because, and this is another thing that is interesting about what we learn about how everyday Athenians were thinking about this, they recognized that there was a low risk of reinfection of the disease. So Thucydides reports that the people who were most compassionate and most willing to take care of others who became sick were those who had had the disease and survived it. And one of the reasons why they were the most willing to help others is because people noticed that there was a low risk of reinfection. People who had the disease once tended not to get it again, or at least not to get it again in a way that was going to be fatal. So again, the ancient Greeks had no conception of immunity as we think of it today, but nonetheless, they noticed this really important fact about how the disease was spreading. And finally, Thucydides tells us something interesting about the kind of moral effects that the disease had on the city. And what happened was, essentially, he says, people became sort of lawless. There was a kind of breakdown in the moral code in the city. And he says this: neither fear of the gods nor law of man was any restraint. They judged it made no difference whether or not they showed them respect, seeing that everyone died just the same. So remember that the ancient Greeks were a very, very religious people. They thought about the involvement of the gods in everyday life a lot like what we saw in Homer and Hesiod. So they were very much concerned with rituals that they would practice every day, sacrifices to the gods, prayers to the gods. They were constantly concerned with how the gods viewed them and wanted to make the gods happy. And one of the things that they were supposed to do to make the gods happy with them and protect themselves was to act justly and piously. But what people noticed during the plague was that people were being struck down indiscriminately. That is, good people and bad, people who committed crimes and people who lived upright, upstanding lives were all equally taken down. And so it created this kind of moral chaos where people were willing to break the laws and break rules that they never would have before because it seemed to make no difference whether one acted morally or immorally when it came to protecting them from this disease. So moral chaos was one of the other sort of political and moral consequences of this widespread epidemic. Okay, so that's a little bit about a particular epidemic that struck Athens. I now want to focus on Hippocratic epidemiology and how the Hippocratics thought about epidemic disease and also non-epidemic disease. So the Hippocratics identified two main causes of internal disease: environment or external factors and regimen. So if we return here to our factors in health and disease, recall that the primary causes of disease is always what's going on inside of our bodies. So whenever we have pain or disease, it's always because something is going wrong internally with us. But the question is, what causes those internal problems? And that's where we get the two secondary causes of disease, which are the external factors and the regimen, diet, and exercise. So they identified two causes of internal disease, two main causes of, two secondary causes of internal disease. How did they determine whether the cause of disease was external or due to regimen? Well, they had actually a pretty logical way of thinking about it. So their principle was this: when different diseases affect different people, the cause is going to be the regimen of each individual patient. So, in other words, if you have a bunch of people are sick, but they're experiencing different types of sicknesses, different kinds of symptoms, that's going to suggest to them that it's not the environment, but rather the particular regimen or facts about each individual's regimen that's causing these different diseases. On the other hand, when the same disease and symptoms affects many different people at the same time, the cause is going to be due to the environment or external factors. So they point out here, and this is where it really makes sense. They say, look, if disease is affecting everybody the same way, regardless of whether they're men or women, old or young, whether they exercise or not, regardless of how they eat, then the cause of the disease can't be individual regimen. They say regimen could not be the cause when no matter what regimen they followed, all people are attacked by the same disease. So if everyone is being if everyone is affected by a disease the same way or the same kind of disease, they say it must be something outside of individual people's lives and regimen that is causing it. So the different sources of disease, these two main causes of disease, call for different treatment plans. So if they determine that the cause is environment, that is, the same disease is affecting a whole bunch of people in a given city or a given area, and notice that this is how the Hippocratics would have diagnosed the plague of Athens. You have the same disease affecting a bunch of different people indiscriminately in the same way. They would have attributed that to environment. So when environment is the cause, then the the recommendation to patients is to gradually reduce their diet and activity. So people shouldn't change the way they're eating or change their regimens when they're sick due to environmental reasons, because their regimen isn't the cause of the disease. But they should gradually reduce how much they're eating and drinking, and they should remain physically inactive. Why should they do that? Well, this last sentence is really key. For such reduction will minimize the need of deep and frequent breathing. So they want people's bodies to become weaker and weaker and for them to be inactive, because activity involves the need to, when we are exercising vigorously, of course, we breathe faster, we take deep breaths. And as we saw last week, the Hippocratics thought that environment is one of the main causes or factors in health and disease, and they thought that air or winds are especially important when it comes to causing disease. And so once they determine that the environment is the cause of a widespread outbreak of disease, what they're going to look to is the nature of the air itself as the source of the problem. And so you don't want, if air is what's causing disease, then you want people to be taking in as little of that air as possible. And so you have this really kind of interesting reasoning here where they're saying, look, don't exercise. That's going to make you take deeper breaths and breathe more of this air in the environment that's causing this problem. Rather, you want to remain inactive and have your body be relatively weak so that you're breathing in less air. Notice that, again, they didn't have the notion of airborne, viruses, microorganisms, that sort of thing that we do now. They weren't thinking about disease transmission in the same scientific way that we do today. However, notice that there's something interesting here, which is you can see something in common with what they're suggesting and, for example, the sort of public health recommendations when the COVID-19 outbreak happened, which was wear masks. In both cases, what you have is an attempt to sort of regulate how much air or the quality of the air that's coming into our bodies. The reasoning behind it is different, of course, but it's this sort of interesting line of continuity in terms of how they're thinking about the way to approach an epidemic outbreak. Okay, so that's the plan if environment is the cause of disease. When regimen is the cause of disease, so people are having different kinds of problems, and each individual patient has their own issues, and that's going to be by far the majority of cases for the Hippocratics. When regimen is the cause, then the recommendation is to correct the unsuitable feature of that particular patient's diets and activity. So now we're going to talk about these final two factors in health and disease, namely diet and exercise or activity, which are jointly referred to by the Hippocratics as regimen. Okay, so diet and exercise were the main methods for the Hippocratics of both preventative care and curative treatment. And we can see why that would be the case. Regimen was the factor in disease that could be controlled, or at least directly controlled. So if the factor in disease is environmental, there's not much you can do about it. You can't change the nature of winds or air quality. You can't change the outside world. You can't change which season it is. So those external factors are not within our control, but we can control what we do with our bodies and what we eat and drink and take into our bodies. So that tended to be the focus of the Hippocratics. And we see this, later in the semester when we look at case studies, we'll see this sort of obsession of Greek or Hippocratic doctors with regimen. So when we look at doctors' notes on patients in these case studies, they're really kind of obsessed with food, water, activity, and bodily fluids. And the reason for that is that they want to study what the person's doing with their body, what is going into their body, and what is coming out of their body, and what all of that can tell us about where the problem is and how to make adjustments to make them healthy again. Okay, so in order to understand how the Hippocratics used regimen to help patients, we need to get into the background of their dietetic theory, their theory of how diet works and how foods and drinks affect our bodies. So the two main theses of the Hippocratic view of diet were these. First, and this is a quotation from On Ancient Medicine, "It is the strongest foods that hurt a person most and most obviously, whether they're healthy or ill. And second, well-mixed foods benefit people and produce health." So the next few slides are going to be devoted to sort of explaining these two main points. So the first thing to note is that foods for the Hippocratics, and drinks as well, have different properties, or what the Hippocratics often call powers. And what these powers are powers to produce certain kinds of changes and effects in the body. When one of these properties or powers predominates in the food and is too strong, that makes the food itself strong, and that causes pain or disease. The strength of the properties or the powers that is in our nourishment is corrected by mixture and combination. So when nourishment is well mixed together, the powers in that food or drink are balancing each other out. They're diluting one another so that no power is too strong versus the others. And when that happens, it counts as a well-mixed or well-balanced food. And well-mixed food of that sort provides strength and health to the person. So here, another way of thinking about this is, if you think about like baking bread and what goes into bread, So bread is healthy to eat for most people, and we can eat it, and it doesn't make us sick. It nourishes us and provides energy and all of that good stuff. If that's true, the Hippocratics would say, because the various components and powers and forms of nourishment that are part of the bread are all well mixed together, and their properties balance each other out. But notice that if you took just any single ingredient of bread and just ate a bunch of that, you would probably feel at least indigestion or a little bit sick. And if you only ate that thing for a while, you'd probably get potentially very sick. So, if I just ate a bunch of flour or just a bunch of salt, for example, or just like, down some yeast, that wouldn't be very good for me. But when you mix everything together, the Hippocratics think what's happening is the various properties that those ingredients each separately have are balancing each other out in the right way and becoming something that is nourishing and strength providing for the person. And why does it nourish us? Why does it promote health when foods are well balanced? Well, here's another critical point. The powers or properties that foods and drinks have correspond to the same properties or qualities that are in the human body itself, especially properties like hot and cold, wet and dry, and bitter and sweet. And of course, we saw that hot, cold, wet, and dry are sort of the four key properties that determine like the qualities that each of the humors has. When we eat or drink something, the food becomes incorporated into our body through the process of digestion. So in digestion, the food is broken down and it goes into the blood, and then the blood delivers that nourishment throughout our body, and then the food literally sort of becomes assimilated into or mixed with our body and its various parts. Now here, this is just a recapitulation of what we learned last week. Humans are healthy when the humors and the properties in their own bodies are well mixed together and in all the right proportions. And they're unhealthy and disease or pain occurs when those various humoral mixtures that are all supposed to be arranged in certain ways in different places and parts of our bodies, when those become imbalanced. So when foods are well mixed themselves, they mix well with the body after digestion without disturbing the proportions of our body's humoral mixtures. However, when foods are unmixed and they have really strong properties that are dominating, then when those mix in with our body's constitution, that creates imbalances in our internal health. So that's why food and drinks on the Hippocratic view are so important to understanding what makes a person healthy and sick. Our bodies are this, I put this image here because our bodies for the Hippocratics are this really incredibly delicate balance of humors in the right proportions, and each organ having its own distinct mixture that it needs in different places in the body, different mixtures. And foods are also all of these like complicated mixtures, and the foods can affect our bodies. And so it just takes something to be a little bit off for things to go wrong with our bodies and cause us pain or disease. Okay, so that's the background theory of diet that informs the Hippocratic theory of regimen and how they make use of regimen. Now let's look at what they do in terms of using regimen to make specific recommendations to patients. So the general principles they employ is that you should use the powers or qualities that diet, that foods and drinks have, and that exercise has to produce balance in the patient's body. And as we've seen, what balance means for them is a well-proportioned mixture, a well-blended mixture of various opposing powers, all in the right amounts. And food and exercise, or diet and physical activity, sort of two sides of the same coin for the Greeks. They have opposite properties, but sort of work together. So they say, for it is the nature of exercise or physical activity to use up material, but of food and drink to make up for deficiencies. So the idea is that when we consume food or drink or nourishment, what that's doing is adding to our body, giving us more sort of bodily material, replenishing our bodily material as it becomes assimilated to our bodies. And what exercise or activity does is use up that material. So we have the material coming in through nutrition and then material going out through physical activity. And so you can use both of them, both activity and diet, to affect what's going on inside of people's bodies. And the basic principles of Hippocratic regimen are the same whether the patient is healthy or sick. So when people are healthy, the recommendation that the doctor makes is that you should use regimen to maintain balance, to make sure that the person stays healthy and that everything remains sort of in the right mixtures and proportions inside their body. When people are sick, regimen should be used to restore balance, to bring balance back to the body. And so they had lots of different recommendations that varied from person to person, from circumstance to circumstance, from time of year to time of year. So here is general recommendations for healthy people. In winter, eat as much as possible and drink as little as possible. Drink should be wine as undiluted as possible, and food should be bread. Okay, so what's going on in the background here is that recall that winter is the season associated with the humor of phlegm, which is known for its coldness and wetness. So what you want to do in winter is counteract the effects that those seasonal changes of you, the coldness and wetness of winter itself, counteract the effects that winter is having on the body of making it colder and wetter. And so when you drink, you should focus more on drinking wine. Why? Because wine has a heating effect. So the heating effect of wine will help counterbalance the coldness of winter. And bread is a relatively dry food, and that will help to counterbalance the wetness of winter. Similarly, walking should be rapid in winter and slow in summer. So here we have the use of exercise as part of regimen, again, to sort of counterbalance the effects of the seasons themselves. When we walk rapidly or move rapidly, it warms our bodies and heats our bodies and thus counteracts the coldness of winter. When it's summer and it's hot, we want to move more slowly so that we don't overheat ourselves. We want to bathe more frequently in the summer because bathing in water has a cooling effect on us, and we want to bathe less in winter when we don't want to make our bodies even colder. And the particular bodies and body types of individuals can also affect the recommendations. So people who are sort of lean and muscular, for the Hippocratics, that means that they have a drier body, so the associated muscularity with dryness, and so they should tend to adopt a moisture regimen, tend to eat moister foods. And in general, when you're prescribing regimens to particular patients, the Hippocratics would pay attention to what age they are, the kinds of habits they have, again, the lands they live in, the environments around them, their physique, and all sorts of various factors about that individual themselves. So when it comes to age, for example, they thought that older people tend to be drier and younger people tend to be moister in their bodies. And so young people should, as a general rule, eat a drier diet, and older people should eat a wetter diet to counteract the effects of the different periods in our lives. So you can see that the person who wants to become a Hippocratic physician needs to know about a lot of different things, the nature of human bodies in general, but also all of the specifics about each individual patient's body, their constitution, their age, their regimen, what they eat and drink, what they do, what their physical activity level is like, etc. They also need to know about all of the environmental and seasonal factors that contribute to health and disease. They also have to know about foods and drinks and diet, what foods have which properties, how to mix foods together to produce mixtures that will counterbalance particular problems in the body. And they also need to know how all of these things above interact with each other and can affect one another. So it's a very complicated set of things that they need to understand. All of these things and all of the little intricacies of how, at least on Hippocratic theory, these are supposed to interact. And if you think back to, our first lecture on the Hippocratics, I think this helps give some additional insight into why they were so critical of theorists who posited really simple explanations of health and disease and thought, if there's a disease, it's always due to a single sort of cause. For the Hippocratics, there's this really, really complicated mess of things that are all factors in health and disease, and all of these have to be taken into account in order to effectively treat patients. However, even when a physician takes all of those things into account, it's still impossible to be infallible in how they treat patients. So the physician can't achieve perfect knowledge of all of those factors. The physician also can't be with the patient every moment to adjust treatment as needed. So, ideally, in ideal circumstances, the physician would be with the patient every moment, and they would immediately notice if something seems to be going wrong, and they could make a quick adjustment. But that's not how doctors work. Doctors will see a patient one day, see how things are going, and then maybe check in with them a day later or a week later and see how things are going. And so you're not making adjustments as constantly as ideally you would. And they can also only provide general guidelines for each patient. You can't micromanage every single decision that the patient makes. So for all of these reasons, medicine is necessarily going to be a fallible branch of knowledge for the Hippocratics. And we saw that in the discussion of Hippocratic epistemology. They think that, it's an inexact science. We're trying to make progress toward getting ever closer toward more exactness and more accuracy. But that's always going to elude us because it's impossible to know everything that has to be known perfectly. Okay, so let's talk now, shift gears a little bit and talk about a different way that Hippocratics could treat patients. So, of course, dietetics and regimen were one of their main methods of dealing with patients and diseases. But in addition to that, they used pharmacology and also various kinds of medical procedures and techniques and surgical practices. So one of the things that they did, or rather a lot of their surgical or quasi-surgical procedures were procedures for trying to control the humors in a person's body. So they made use, for example, of purgative drugs. So remember that, when something's wrong with our bodies, it means that there's tends to be an excess or deficiency of one humor or another. And so a purgative drug, something that makes you vomit, could be, for example, a way of reducing the yellow bile in a person's body. Laxatives and enemas are another way of clearing out certain humors from the body. The practice of cupping was something else. So we have lots of this is an ancient cupping instrument. We have a lot of these that are still exist as artifacts. And what this would do is, it worked not unlike cupping today. This instrument would be heated and it would be placed on a certain part of the body as a kind of suction cup. And the idea would be to draw blood toward that part of the body. So you could use this, for example, if you thought that there was too much blood in a neighboring part of the body and you wanted to draw it away, you could cup nearby to get the blood out of that place and into the other. Bloodletting was another common practice. This was a practice of bleeding a patient. So here is an ancient depiction of bloodletting. The idea here is that the doctor is about to cut the patient and bleed some of their blood out into this basin here. And sometimes bloodletting would be combined with cupping. So you might use cupping to draw blood to a certain part of the body and then bloodlet to release that blood from the body. And there was also drainage. So things like drainage of wounds, drainage of sort of like the phlegm-like or pussy substances that could be in blisters or wounds, for example. Okay, so a lot of their procedures were sort of directly focused on, okay, how can we influence the distribution of humors in the body? How can we get rid of excess humors that are causing problems? There were also some additional procedures that they used that were mechanical in nature. So, they used bandages, they could stitch up wounds. We saw that even in Homer, there was the use of things like bandages, but Hippocratic doctors would use these too and could also, again, give patients stitches for open wounds. There was the use of cauterization of wounds. They also used splints on broken bones, and they could relocate dislocated joints. They made use of something called the Hippocratic bench. So here's an artistic depiction of it. This was a device that was used to sort of stretch the person, and the idea was to help get mislocated or dislocated bones back into their proper places. They also made use of trepanation, which was a process of drilling very tiny holes into the skull to try to release excess humors that were supposed to be located in the cranial area. And finally, they also made use of sometimes just amputation of appendages. So here's an ancient depiction of these are cupping instruments, and then this is a physician's case that they would have carried around with them. Again, physicians were often itinerant or travelers. They would go to patients, and so they would have like carried a little case around and taken that with them full of instruments. And so this is what that's depicting. And then here's just some ancient artifacts of various medical instruments from the ancient Greek world. Okay, so that is all for today. Next week, we will be looking at medical ethics, and in particular, the sort of Hippocratic code of ethics that they expected of doctors. I will see you all then.